Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelson, professional horse trainer, and with me, my good friend, Deb Romero, certified Alexander Technique instructor. And today's topic is it's really a follow-up from the podcast I did with Stephanie, who you work with as well,
Yeah, I
the
do.
nutritionist.
Hmm.
And it kind of I've been wanting to follow up on this whole sort of anti-inflammatory diet change. But I
Hmm.
wanted to, rather than discussing it with Stephanie, which I have done on past podcasts, I wanted to discuss it with you because as horse owners
Hmm.
and working with horses in training, what I've come to realize is that the inflammatory response, sometimes through food or medication that has nothing to do with the training, um, it comes out in weird ways, different
Oh,
ways.
no kidding.
And it's not really the same for every single horse. And so
Yeah.
I kind of wanted to talk about recognizing that
Mm.
inflammation response in
Hmm.
people and horses. And I think push your microphone up a little. I think it's down. There you go. Um, like for example, the horses that I show in the Wexford Training Barn playlist on the YouTube channel,
Hmm.
Hercules, his inflammatory response, and he was the first one actually on this diet like years ago
I remember that. Yeah.
because we had to have the stifles injected. Hercules had OCD tears on both condyles of the stifles, and one of them had healed about 50% of the way by the time we found it. So the vet recommended, let's inject the joints, let that heal up fully, and he should be good to go without the surgery. So we're like, okay. And it was supposed to heal in like 6 months. We should have seen a tangible difference. So
Right.
nine months, I'm not seeing a tangible difference. I
Ah,
go, we give it a year, right? And then
wow.
re-X-ray it, and it still had not fully healed after 12 months.
Wow.
And so I'm like, something's wrong, right? So once again, we pull blood, we run a bunch of tests, and it just so happened his allergy panel on a blood test, not a full allergy panel,
Right.
which is more extensive, but just on the blood test, he turned out to be allergic to like every known horse food other than like alfalfa. He was even allergic to
Wow.
timothy. He's allergic to flax. He's allergic to like
Wow.
corn, soy, wheat, barley, all of
And I
that.
think those are all the big ones that Stephanie's named on her podcast to look for in your feed.
Right. So
Yeah,
with a
big
food
ones.
like
Big ones in the
Stephanie,
human food chain.
yeah, because her five ingredients that she talks, and correct me if I'm wrong, she goes, even if we do nothing else but eliminate
Mhm.
the inflammatory trigger foods,
Yes,
which are for horses, and you're saying for people,
of
co
course.
corn, soy,
Mhm.
wheat, and she says molasses and canola oil.
Mhm.
And I went through all my supplements as well as every
What
bagged
a good
feed.
idea. Not just a bag of feed, but your supplements. Wow. Bingo.
You would not believe how many
Wow.
supplements have one or more or all of those inflammatory ingredients. And so poor Hercules not only had the normal inflammatory response, but it was like times 100 because he actually had food allergies on top of it. And
That's
that
amazing.
horse, when I changed his diet, because Hercules, like he must have been in pain all the time with joint inflammation, on
Hope he
top
didn't
of
kill
having,
anybody.
I couldn't believe it. But his worst habit that got us kicked out of mini barns was that when he came in every night from turnout, he would just brace and pull the lead rope out of your hand and kind
Mhm.
of kick out his hind legs as he went by you. And it was just dangerous. It got us kicked out of a lot of barns. And the barn
Right?
I was at, or the barn he was at when we decided to do the diet change, I had to go to the barn owner and go, we're going to take him off of all grain and he's going to be on a straight alfalfa pellet diet or alfalfa cubes or pellets, straight alfalfa with a fat supplement. And she looked at me like her eyes got big. She's like, "You're going to put that horse on alfalfa?" And I go,
Right.
"That's the only thing he did not have an allergy to."
Hmm.
So I think we put him on alfalfa with like olive oil, some
Right.
weird fat supplement. And within 3 days, his behavior completely calmed down.
3 days.
Within
Wow.
3 days of that diet, he was a calm, cooperative dude. And I
Amazing.
just went, oh my God, this horse has been suffering for a really long time.
Well, we found that with my big mare, Callie, who we used to call airs above the ground because that's where she spent most of her time. And I would some of the cues that came up to me that it didn't come to me at first was extremely skin sensitive.
Yeah,
Like, I couldn't figure out why don't you like being hosed down when it's 100 degrees outside? You
right,
know, she
right.
would run around like, "Don't touch me, don't." Same thing with brushing. And we were talking one day, we're at the arena and you brought up, what is that
Oh,
warm
the
blood?
PSSM,
That
the
thing,
polysaccharide storage myopathy. And
whatever that is.
well, and what's so interesting is for all horses with metabolic issues, with
Hmm.
food allergies, with that PSSM or EPSSM, whatever you want to call it, which what that does is they digest the sugars, but they don't, what is it? It's like the sugars, you get a sugar storage in the muscle. And so it's a
Right.
little bit like a chronic tying up.
It
They get
was. It was
really
like she
tight
was
and really
tight. She
sensitive.
was tight everywhere.
Hmm. Right. And so that can be pretty common in paint horses, a lot of warm bloods, some
Hmm.
thoroughbreds. There's different types of PSSM. You have to, and
Right.
the only way to know for sure is a muscle biopsy. But bless my sister's heart, the vet, she goes, the cheap way to find out is change the diet and see if they change.
And
And
that's what we
that's,
did for Callie, and totally different horse.
yeah. And what's so
Completely different horse.
interesting is like whether it's metabolic laminitis, PSSM, or allergies, the go-to diet was eliminate grain, put them on a forage-based diet. The fat supplement is super important. And then
Yes.
Stephanie explained how it regulates the hormones. So
Right.
even the air plants, the horses that get fat just looking at hay, it's like the last thing we think of for a metabolic horse that's too fat is to give them a fat supplement.
They think that that's a relationship, but I do remember Stephanie saying that what you're seeing, those deposits on the body, what may not be actual fat, they're an inflammatory response in the fat. Does that make sense?
Hmm.
Something like
No,
that.
she
So it,
said that like the liver gets to a point where it can't process toxins and they can
right.
be
So it,
sort of pockets of toxin, not
hmm,
necessarily fat. The other
right.
thing she said that was so important is the last thing you think of is giving a fat supplement to a fat horse.
Hmm.
But until there is enough fat in the diet on a regular basis, the body is triggered into storage mode. So you
Right.
actually can't, the body won't burn fat unless there's fat in the diet.
That's, in my bodybuilding days and when I got down to like 9% body fat, it's a real scary place because then the body converts muscle tissue if you're not getting enough fat, and the brain needs fat. So all of
Yes.
those functions need a healthy fat, not the canola, not the vegetable. There was just a publication out or something out on Facebook about how we've been sold how wonderful vegetable oils are, and they're truly not.
Not necessarily. And not only
Yeah.
that, but different fat supplements can
Mhm.
also have either allergic reactions, digestibility, or
Mhm.
a lot of commercial oils are mixed with something that cuts it, that isn't
Yeah,
necessarily healthy. Like if you can find pure canola oil, it's probably okay, but most canola oil is there's some synthetic ingredients in it that are not, that are inflammatory producing.
right.
So it's one of those things that finding a healthy fat. So some of the horses in my barn, especially the metabolic ones, I have on a coconut meal fat supplement,
Okay.
where the ones who need to gain weight, it's a product that mixes rice bran with flax with coconut oil. Um, and that one works very well. Or pure flax or something. I think there's something about finding the right omegas in the fat supplement.
The omega-3s to the omega-6s and 7s. Yeah,
Yeah, and
Stephanie
that's
obviously knows much more about that.
yeah, I go that's over outside of my wheelhouse.
I just dial up Stephanie and ask for what I need.
Yeah, what's the recommended product? I'll go find that.
I'll go find that. Whatever it is, I'll find it.
But
Yeah,
to kind of
she's
come back to what was interesting was when I switched Hercules to this diet, not realizing it was anti-inflammatory across the board.
mm,
It was like just taking away the ingredients that were perpetually, because he had no outward symptoms of these food allergies, none. He never
not
had a
like
runny
people like
nose,
hives or,
never had hives, never had irritated
what
eyes,
we
never had
think would
coughing.
be a response. That's
Right.
the hidden agenda of it all, is we think if they're allergic to something, it has to look like this module, and it doesn't at all. It doesn't look like that at all. In some horses, finer things, I was watching her out in the paddock one day and she just stood there and was kicking out her legs. Nobody was even close to her. And she was just, and I'm like, what the heck are you doing? So luckily, I have a good relationship with Stephanie. So I texted her and she goes, oh, we need to test her for Lyme.
Really?
Yeah. And she came up having Lyme. It's
Yeah, and Lyme to me, Lyme disease is like dietary inflammation responses.
and it can be.
I have never seen two horses have the exact same
Nope.
symptoms. And
And
that's
my,
when I
yep.
started to realize how insidious dietary inflammation was. I go, that's why I
Hmm.
wanted to talk about it on this podcast. And especially what I've been going through with Prima, who has been with me my whole life. She's 31. She's been on, that horse stayed fat on cement. She was always like a roly-poly little thing, loved her grain, has lived off of senior for many years and always looked fantastic. But
Right.
training wise, she always
Um,
like, and this is sort of what starts to alert me to these issues now. Having sort of sorted out mechanics and how to discourage dysfunction and encourage healthy function of skeletal coordination, 9 times out of 10, the horses just kind of slowly but surely get better. The slow ones offer more forward. The fast ones can control their movement. They slow down. The steering gets easier. The posture gets better. The horse is more stable.
right.
Everything gets better. And then I come across horses where I feel like I'm pushing a rock up a hill every day. And they're just not making the same kind of improvements that I've come to expect. And my horse being one of them. So Hercules was in that category. And luckily, we had the pathology on the hind legs as a gauge to go,
That's true.
something's going on. That OCD lesion is not healing in the time it should. So something must be irritating his joints. And we did, we found the food allergies, we changed the diet, and then he finally healed up without a second joint injection. He healed on his own, and his personality changed, his behavior changed, right?
Yeah. And I just had a conversation with Dr. Hancock because I had a friend ask me about an arthritic response in her horse. What did, we had an office meeting and I asked her, and the first thing out of her mouth was, you've got to get rid of the inflammatory diet because you want to treat the problem. I see that, but you're maybe just not treating the cause.
Or something that is hindering healing, if nothing else. It
Right.
is
Oh, and
hindering.
I've
Hmm.
got that with a neighbor's horse right now. 2, 3 weeks we're going on open sores.
And
And
yeah,
the
the heat.
healing process is just not engaging. And, that's when I would start question. And another thing, these two that are on these processed feeds, the flies. It's amazing how,
Interesting.
yeah, that was a big thing. And I asked Dr. Hancock about that, and she looked at me and she says, I think we don't have flies because our horses' guts are so healthy. They're not in an inflammatory response, therefore the flies aren't attracted to them.
Well, I
I don't know.
wouldn't
It was
say, I
just a
mean,
theory.
mine are all on that diet. I still have flies, but
Well, I have flies, but not like an overpopulation on the horses,
mm,
where you can just see the difference. So, and then you know, that's when you need to have conversations with outside people like, hey, this is going on at my barn. What's going on at yours, kind of thing.
well, and I notice going to different barns what the flies are doing in general versus what they're doing at a specific barn. You kind of see the pattern.
Good point.
But but I wanted to talk specifically kind of about Prima because just like with your big mare Callie, without getting the vet involved, you just changed the diet because it's not going to
Mhm.
hurt her. And you took her off the grain, put her on the same diet Hercules was on, and she actually started to progress in training and settled down
Yes.
and became less
Yes.
skin sensitive, less
Yes.
less reactive kind of to
I mean,
everything.
yeah, I mean, it was a life-saving event for me.
Yes,
Can you imagine being skin sensitive and somebody throwing a saddle on you and then
I
getting
know.
on? No wonder she was freaking out.
Yeah. Yeah, and Hercules being ridden all that time with inflammation in the
Yeah,
joints
that's
and
amazing.
even pain on the stifles. It's like the fact that he didn't try to kill us. The worst thing he did was he could just blow through a rainade and you'd lose steering, or
Right.
you couldn't get him to move forward. I go, that was kind of his worst behavior. Other than when you led him on a halter and lead rope, he would pull the rope out of people's hands.
Right.
And but that was the only time he really blew up. And with Prima, well, actually, when I changed the diet for the whole barn, a couple of interesting things happened. The two horses I have in my barn that are on pergolite for their metabolic issues, they both have
Right.
cushings.
Right.
Both of the horses were able to reduce the amount of percent they were on with veterinary oversight. And
Yeah, the numbers change.
the numbers
The
changed.
numbers change. We have seen that. Yes, that's a
And
good one to bring up.
yeah, because that pergolite, the Percend is the brand name.
Right.
That's expensive stuff.
It's very expensive.
Yeah.
Yeah.
And one horse was on 2 tabs a day
Whoa.
and was able to go down to 1.5. We tried one, her numbers bumped back up, and we went back to one and a
Mhm.
half. And her numbers now are lower than since she's been tested.
Yeah.
And so she's kind of maintaining on 1.5. And the other mare went from 1.5 to 1, and her
Good
numbers are
deal.
maintaining. And then Rafalco, my warm blood, he always had, as long as I have owned him, he always had what I call cankles, like these fat fetlocks, right? That just, I figured it was from past sort of tendon ligament strains. That was just how he was going to look. It didn't affect his movement, but he always had
Right.
these fat hind leg fetlocks that kind of went above and below a little bit the fetlock, and they were just like old lady cankles. They, just fat. And
I can't see that picture on him. Sorry. He's so big.
and I didn't even notice it first. I think I was rinsing him off or had him in the cross ties for something, and I went, "Oh, your hind leg fetlocks look normal. Where'd all that swelling go?"
Oh.
Like I had just quit kind of addressing it, but he was always super prone to pastern dermatitis, like scratches,
Oh,
and
yeah, that's a big deal from gut inflammation.
he would get scratches every summer, no matter what I did. He would blow up sort of threatening cellulitis response,
Mm-hmm.
when he would get the dermatitis. And even when he didn't have dermatitis and everything was golden, he still had these fat fetlocks. They were just kind of fluidy and puffy. And I think it was probably a month. It occurred to me, I'm like, he doesn't have that puffiness anymore. It just went away.
And you
And
can see
then,
it in people. I can see the same response in people that have a inflammatory gut or a bad diet. Their faces are puffy,
or
eyelids are
they have
puffy,
puffy around the joints,
puffy, yeah, that's
puffy
and around their
legs.
ankle, all of that. I see that in an inflammatory response to diet.
Yeah, so that was a different type of inflammatory response, like a fluid retention type
Mm-hmm.
in
Mm-hmm.
response versus um, Hercules or your horse who got really tight, like Hercules in the joints, your horse kind of in the muscle or the skin,
Yeah. Mm-hmm.
and then Prima. And, Stephanie sort of said it's theoretical, there's no proof, it's just sort of a theory floating out there that things like lipomas, which horses get that cause colic,
Mm-hmm.
and things like even benign tumors like sarcoids and that kind of thing can be inflammation responses of the body.
Makes
And that
sense.
is, it's purely theoretical, but it does kind of make sense. And I go, Prima, when she was 28 years old, had such a bad colic, we had to take her into the clinic. And at the clinic, she got to a point with medication that they said, you have a window for surgery, um, or if she's not a surgical candidate, we're going to hit her up with more meds and see if she can pull through. So I opted for the surgery with a 28-year-old horse, and I basically discussed with the surgeon if it's a strangulating lipoma or if it's anything that requires a resectioning of any part of the
Mm-hmm.
intestine,
Mm-hmm.
I said just put her down on the table. I said I haven't seen recoveries from that, especially in an
No,
older
that's not
horse.
not easy.
I said if it's something that is removable without any interruption or resectioning of the intestine, then go for it.
Right.
Do what you can do without any kind of snipping of the guts. And then, I left it up to the surgeon. I said, but that's where I'm
And you
coming
weren't
from.
even home, as I recall.
I was out of town for
You
the
were out of
surgery.
town when all this was going on.
Yeah.
Oh my goodness.
No, and we have an
Oh,
amazing clinic in Ocala, Florida that was just a shout out to Peterson and Smith. Like they were just amazing.
lucky
And
you.
the surgeon answered all of my questions over the phone. We had a long discussion. We had a plan, especially for Prima was in fantastic shape as a 28-year-old.
That's true.
So
You
I
kept her in
knew
work. That's good.
she was healthy enough to make it through the surgery if it didn't involve resectioning. So what they discovered when they opened her up was 5 lipomas. And the way lipomas
Were they
form,
like in the mesentery, but not
so the way they form is it's a benign tumor that initiates growth on the wall of the abdomen.
the wall of the abdomen? Okay, got
So it
it.
starts, out there by the rib cage on
Right.
on the wall of the guts, and then it grows like a mushroom. So
Interesting.
it has like a root that forms on the outer part of the abdomen, and then it grows inward like a mushroom, and it has a little bit of a head to it like a mushroom. So the longer it grows, the longer the stem gets,
Okay.
right? And it's the stem with sort of this mushroom cap that's a little bit of weight that when the horse rolls or just because it finds its way there, the more it's growing, it's the stem that wraps around the intestine that
Oh,
strangulates. That's why it's called a strangulating lipoma. So you can have a lipoma, like in Prima's case, it was just taking up space and it was starting to
Right.
press against the intestine, creating a bit of a blockage, like narrowing the intestine itself. So she kept impacting,
Ah,
right? So it can interfere. And that's what what's the other one? The sarcoids? No. I had
there's
another mare who had the ones that the white horses
the
get,
melanomas.
melanomas.
The
And
melanomas, yeah.
and the melanomas can be benign, but they
Hmm.
can also interfere. So they're typically on the anus and the neck on horses, and they can get large enough that they interfere with breathing or they interfere with digestion.
Right.
And it's just the mass of the tumor that starts to interfere. And so that's what the lipomas had done with Prima. None of them had actually wrapped, which was a freaking miracle
No
with
kidding.
5 of those things floating around for God knows how long, right? But it started to explain why she would get tight in her back, why she
Mm,
resisted lifting her back, why she was having so much
mm.
trouble engaging the hindquarters, and all of these, and probably why she didn't want to go forward. And
And
so
she's so
she,
stoic. She doesn't, she doesn't act out really.
no, and she just
No,
kind of
she's
did
just
her thing, like the
right.
training.
So there was no big explosions like my mare would just, explode where Prima doesn't do that. It
No,
was
she
very
just
subtle.
very subtle but opinionated. She kept telling me this isn't comfortable in different ways,
Aha.
but and
Good
and never
point.
ever, like 100% of the time when I correct the spinal functions or guide the spine to better function, horses like her that don't have an impulse to really move forward, they gradually start to offer more and more forward energy as the coordination changes. And with
Right.
Prima, we were just stuck like in a cloud of turtle dust every place we went. She just had, and she's an Arab. And I go, she's the Arab with no forward,
Yeah.
none, none. And I went, Something's not right." But I didn't know it until she had this colic. I had addressed lots of other issues, didn't find anything wrong, but that bad colic and then the subsequent surgery, that just explained so many things.
Right.
And then when she came back, they said basically the recommended thing was keep her on a diet of senior mush or mush food. And that's what she had been on. Didn't think twice about it. She recovered really well. It was like it took 10 years off her life. She had suddenly all this extra
Wow.
energy, right?
Wow.
But with all this extra energy, she also kind of had cow patty style poops. So instead of
Right.
normal ball formation, she had these kind of ploppy, soft cow patty type poops. And even the vet was saying that could be the new normal from disrupting all the guts and moving everything around in there,
Oh, good point.
and just opening up the abdominal wall. You're going to have an inflammatory response from human fingers
Just,
touching
yeah.
all that
And the
stuff.
whole being upside down,
Hmm.
the pressure that, because if I recall from my vet tech days, the intestinal system of the horse is the length of a football field.
Yeah,
It's massive. And you go
massive.
and take that amount of weight and you put that horse upside down for any length of time, big changes.
Well, and
Big
then what they
changes.
do surgically is they cut the lipomas from the abdominal wall. So you have a lot of
Right. There's
inflammation
a
from
lot
that.
of
And
tear. Yeah,
yeah.
that's uncomfortable.
So her energy level skyrocketed after that surgery, but her poops were kind of weird. And the vet
Mhm.
said, could be because of the surgery, could be her new normal. We'll just wait and find out. So time passes. I'm working her again. She's happy. She's more forward. She has more energy and looks great. And so then I talked to Stephanie and I put the whole barn on this new anti-inflammatory diet. Everybody else has a super positive response, and Prima looks like she lost 100 pounds in a week.
Oh,
Like just her whole body just looked like somebody took the air out of it and
oh,
deflated it. And I thought, ooh, not messing with this. So I put her back on
That's
the
scary.
senior
Mm-hmm.
and she plumped back up. Her poops never changed. Like she continued to have these kind of cow patty things until we started to notice, oh, good, she's having some ball formation in her poops, but they were on the hard side. And
Going the other direction.
within 2 days of her pooping
Wow.
out normal balls, a little bit hard, she had another massive colic,
Oh, geez, Louise.
massive.
Almost like
And
IBS.
yeah, actually,
Yeah.
yes,
Yeah.
absolutely. So this second colic, I go not doing surgery again, not sending her to the clinic. We ran IV fluids. We hit her up with major drugs all night long. It was a sleepless night. She managed to pull through with the IV fluids and the drugs. But I'm like, I just can't go through that again because the heart rate escalates. They're in so much pain,
Yeah.
and you have to make the call at some point. And I'm like, I don't think she could have grown another lipoma that fast. We're talking within 6 months this happened, right? Of the
I don't,
surgery.
yeah.
And so after we got through that episode, it finally occurred to me that maybe her inflammatory response was in the soft muscles, that it was related to digestion.
Mm-hmm. The smooth muscle
The
tissues.
smooth muscles, that's what I wanted to
Mm-hmm.
say, smooth muscles. And
They
because I
just
knew
spasmed.
like your horse and Hercules were having the inflammatory response in the locomotion muscles,
The muscles, yeah, on the
the outer
skin.
muscles. And I went, maybe it's the smooth muscles, the digestive tract that's really getting inflamed. And so I put her back on the forage diet. She lost the weight again. And I said, but within a week, she had some soft ball formation in her poop.
Right.
And I go, that's a change. It's not the hard balls and it's not the plops, right? And
Right.
so over time, like of course I restricted her hay. All of her meals were wet and soaked. Um, and she could graze, but I went no more dry hay because that impacts too fast. But even without the hay, she started to get more and more normal in her poops. And I go, that difference alone
Mm-hmm.
told me I'm getting farther away from colic. That those
Farther away from
ploppy,
colic. Good
yeah,
point.
those cow patty piles were not normal, were not her new normal. And from cow patties to hard little ball formation was another colic waiting to happen. So
Yeah.
she kind of went from ploppy poops again very slowly over maybe a couple of months. Her poops restored to almost normal, a little on the soft side, but clear ball formation. And I
Right.
go, that was the one indicator that her guts were feeling better. And then the
Normalizing.
and then as bad as she looked, and I have her training episode. It's pretty boring training to watch because we just work on the long reins at the walk, but she wants to work every day lightly. And the more I've been working her, what I realized was how tight all of her outer muscles were.
Well, that's kind of
And
like my big mare was. Yeah.
and that everything that made her look plump and round was inflammation.
Good point.
I
Really
went,
good point.
oh my God, so that sudden weight loss was a release of inflammation. And what I
Mm-hmm.
saw underneath it was horrifyingly the truth about why she didn't have a lot of forward, why she couldn't lift her back.
Right.
And I was sort of horrified. Here my poor mare is coming on 30 and I just figured this out.
Right.
And
We
so I
all have
went,
those moments.
I realized that severe weight loss was the least of our problems. I go,
That's a good point.
if she can stay colic free, we can slowly put weight and muscle back on. And finally, after months on the long reins, she has finally initiated that desire to give me more and more forward energy. And it's taken a while to build up the strength of her back and hindquarters, but she's getting there. And now every month I'm seeing tangible changes. She's getting round again very slowly, less ribby, less angular. Still a
Yeah.
ways to go to build up the top line muscles, but it's like her belly rounded out. I go, I think she's got enough weight. I think the rest of this is a muscle issue. She just,
And
under all
that's a
that
really,
inflammation, I didn't
yeah, that's a
realize how
really
weak
good
she
point,
was.
is that because we've been led on by modern medicine, here you take a pill and you're better. This stuff takes a while. This is not,
It's not an instant fix.
it's not an instant fix. The gut, the whole microbacterial organization of the gut has to change. And maybe that's why she was so slow. It's like all of my energy is going to all this inflammation in my gut. I can't
Yes,
possibly put any energy into moving forward.
exactly.
Yeah.
And she's such a kind horse. There was
Yes.
really and a safe horse. Like even if she was in, in a lot of discomfort, she still was a lesson horse for people who came. I could ride
Right.
her. It was just sort of painfully slow.
Yeah.
And she could not tolerate rain resistance. Just would not have
Wow.
you restrict her on the reins. And so she was quirky, but anything that made me think there was something much more
Deeper.
nefarious lurking around.
Yeah.
And here
And,
I
and
come,
I
it took a severe colic and a colic surgery to really discover what her issue was underneath everything. And
and I'm
it,
always saying that because I feel like I live on this tiny little island about these things, that Western medicine has its purpose, but there's this whole other community of way of looking at things that we can check and
yeah,
may and see about this stuff. That, for instance, I was having, it went on for like 6 months, achy all over. I just ached and ached and ached. And I finally went to my DO and I said, I think my Lyme's back. She drew blood. She said, no, your Lyme's not back. Then I went and saw my naturopath who has a bioresonance machine, which is more of an energetic field. And she said, oh, you're riddled with Lyme.
interesting.
Yeah. So I went through a 3 month protocol to clear Lyme that way. So,
And it
and
restored
I
you.
think a lot of clients come to me, and maybe to you too. It's because they've been through all these channels and their horses are still not where
Yeah.
they need
And
to be.
that
Does that make sense?
Well, and with the type of training I do now I
Right.
know sort of a normal rate of change in the
Right.
coordination of the body if we don't have some lurking issue underneath it. And
Right.
so now, when horses are perpetual behavioral issues in the
Good
work
point.
I do, or when a horse really can't slow down, or a horse really doesn't offer forward, right? Or the steering is really difficult one direction versus the other, and it's not improving. I go, now I'm pretty quick to go, let's look at the diet, let's test for Lymes, let's test for EPM, let's
Mhm.
look at something more systemic as part of the lack of progress in training.
And even a lameness. Even if what we have a really good trained farriers here, in soul depth and all that. But if the x-rays are coming out clear and you still have a quote unquote lame horse, maybe you should be looking at something else.
Yeah, because even the side effect of Cushing's that the vets fail to sort of make clear to all of us horse owners is two things. One is they are not so good at thermoregulating their body temperature. So they get colder in cold weather, they get hotter in
Mhm.
hot weather. They can't thermoregulate as well. And two, it creates a laxity in connective tissue. So we're talking fascia, tendons, ligaments get a little bit too stretchy and they're more prone to,
To ligamentous problems.
yeah, to
Good point.
tears
That's a
or
big one.
inflammation.
That,
And
like you said, I that's not broadcasted by any means.
no, and I know all the vets know about it, but it's one of those side effects that they kind of forget to tell us as horse owners. And we go, why is my horse so cold, or so hot? and they can go into, a cold stress or a heat stress because they can't thermoregulate as well, or they're more prone to a tendon or ligament strain or tear or injury all of a sudden. And so changing the diet, I go, that's something that's in the power of all of us as horse owners. And the worst thing, the one complaint that I experienced and everybody else who's tried this anti-inflammatory diet is some horses appear to lose weight rapidly and drastically.
Yeah.
And we're all
Yeah.
horrified when our horse looks like a
Hmm.
rescue horse and the neighbors are going to call the county. But
I
I
remember
actually,
talking to Stephanie about several of those, and they just wait it out, send
and
pictures,
I
wait it
get it.
out.
I did the same thing everybody
Yeah.
does. I put my horse right back on senior.
Yeah.
And if it wasn't for that second colic episode, I probably would have left her on senior the rest of her life at her age and not messed with it. But after that second colic episode, I went, okay, I don't want her to die out of pain. I
Not
want
that
her to
way.
be
Not that
comfortable
way.
in her old
Yeah.
age. And so I switched the diet, and sure enough, I think what we're seeing as weight loss is a dump of inflammation, just like the hind legs on my other horse.
Yeah. Just like people, like I said, when I can see people and that is, I call it,
It's like a
call it
puffiness.
the layer of filth.
Yeah,
Sorry, but I can just see it, and I
it's like edema. It's
that's a good
like
way to put it. It looks that way.
it
And it's
is,
just
and
an
it is.
inflammatory response. The body's just trying to get rid of whatever toxins you consumed in your food.
Yeah,
It's just that simple. It's got to go somewhere.
yeah. And so now I try to help people if their horse has that drastic weight loss. It's so hard to look at. But
It is.
I increased the fat supplement. That mare never saw the bottom of a bucket 24/7. And
Yeah.
I
Just give
gave
them
her
food. Yeah.
as much as she would eat, but it was all within that recommended anti-inflammatory diet. So she got unlimited hay pellets and hay cubes. I doubled the fat supplement. She's on a much better vitamin mineral supplement. I boosted the gut. I did probiotics at one point, then the OGS gut solution, and just tried to kind of rebalance everything. And now, also coming into summer where she can graze more, she's
Right.
finally plumping back up. And I'll do an update, I think, the beginning of August, because I did show her almost at her worst on my YouTube channel. And it's under the playlist Wexford Training Barn, and she's listed as Prima 1, 2, 3, 4, whatever.
Right.
But month after month, it is not exciting to watch her walk around on the long reins.
Hmm.
But video by video, I can look back and go, yes, she's looking better, even though still too skinny. And only
Yeah.
now she's not looking dangerously thin like a rescue horse. She just looks
Right.
underweight. So she's really put on quite a bit of weight. And the most important part is since the diet switch and what appeared to be a drastic weight loss, she's more comfortable moving. I'm getting better changes in training. And knock on wood, I hate to say it out loud, not
I
a
know.
single colic symptom.
Well,
Not even a fart stuck sideways, as my sister likes to say. Like just nothing. And
good.
yeah,
Good.
and her
Yeah.
poops have been normal and consistent. And now that she's getting a lot of grass, she has completely normal looking poops. And when she's only on soaked hay or, sorry,
Mhm.
soaked cubes or soaked pellets, they're a little on the soft side, but she gets plenty of hydration that way with her food.
Right.
Um,
Yeah, and another thing I know Stephanie talks about is what's the stress level in the barn?
well, that part I'm pretty good at. Like that
Yeah,
part, I go, that was
I'm just
not,
thinking like boarding barns and
no, but at my barn and my horse, I go, yeah, that I can check the box on that
you can
one
check that
safely.
box. That's
Yeah.
good.
Yeah, I can check that box. And I know the normal course of changing skeletal coordination has a systemic effect on improving their health.
It's all related.
Yeah, I go,
It's
so
all, it
the
can't, it's not
two,
just one thing.
right. The two things I know I can do through training is keep them out of a stress response, keep them in a
Yep.
parasympathetic state, and I can guide the coordination of the skeleton to restore ideal function or mechanically sound function that's going to influence the lymphatic system, the circulatory system, and the digestion, as well as hoof growth and all these, metabolic issues. So restoring correct function through movement also addresses the function of all systems of the body because
Hmm.
it's all tied together. So that part I was good at. What was stumping me was when I have something that is a medical issue, either a joint issue, a tendon ligament issue, colic, metabolics, that kind of thing. I
Hmm.
go, I can't override that through training.
Correct.
And what
Yeah.
I find is horses with these underlying medical issues that are sometimes hard to diagnose or hard to figure out, I go, that's where a lack of change in the behavior, horses that are chronically stressed or chronically plateauing in their
Right.
training, I go, that's now my red flag to
Right.
go, let's look at some underlying causes for that.
Yeah.
And,
Yeah.
inflammation or lipoma formation with horses, like the theory is the reason they form the lipomas in the first place can be the inflammatory response.
Exactly. That's what I've heard from Stephanie is
And it's theoretical. The
it's
vet will
theoretical,
not
but I
confirm that. That has not been
right.
proven.
Right.
But I go on a practical level, if my horse isn't colicking anymore with this diet change and her poops look better and she's offering more forward, that's enough for me. That's enough for me. And
That's good.
she may have another colic, she may form another lipoma, but right now things are going the right
Things
direction.
are okay. Good.
And so I go, that's the best I can do.
Yeah.
But to watch the dietary, those, and again, we should repeat the 5 inflammatory ingredients in horse feed and supplements. And it's not
Supplements
about,
too. Wow, that's big.
well, because vets are trained to look at protein to fat to carbohydrate ratios.
Hmm.
And what Stephanie was saying is whatever that ratio is of protein to fat to carbohydrates, that's a different issue.
That
That
is
is, it is part of nutrition and nutritional balance, but that's very different than the ingredients used to achieve those
that.
ratios.
That's a good point.
Yeah,
That is the point. What are they using to get there?
exactly. And if you look at
Yeah.
most commercial feeds and most commercial supplements, they use wheat midlands, soy hulls in almost everything as a filler or
Hmm.
a carrier of the nutritional
Right.
components. And it's just bulk, so they figure no harm, no foul, which that's what I always thought. But the wheat midlands, soy, even if it's a corn-free diet, are those two things are still creating an inflammatory response
Mhm.
that has nothing to do with the nutritional ratios. It just,
Exactly.
yeah. And I go, they're two different things. And I don't think like it really takes a nutritional bleh, spit it out, specialist.
And I think you hit the nail on the head because it really needs to come from a nutritionist that isn't connected to a feed company.
Yes. And the feed companies are very good at balancing that sort of ratio of carbs to fat to protein based on different horses' needs. But the ingredients was the wake up call.
Yeah,
And I
it's
went,
just like for people.
if
It's
I
the
can
same thing.
eliminate the 5 ingredients were corn, soy, wheat, molasses, and canola oil. And I still give my horse treats. Like it's just like me. I'm sort of gluten intolerant, but I'm not I don't have celiac disease where the gluten
Right,
will
where it's a
kill
big
me.
deal.
Right. So I
Yeah.
have a definite inflammatory response to eating gluten, but I can get away with a little bit here and there. And I go, that's kind of how I look at giving my horses treats or things like that. Is I go, if they get a little bit of molasses here and there, or some of these inflammatory ingredients, few and far between and in small doses, I don't think it hurts them. But on a regular dietary basis, they're
Mm-hmm.
not getting it every day, twice a day. And that's what's
Right.
made a huge difference.
Yes.
And then not knowing how a unique body is going to manifest the inflammatory. I go, it's just
Right.
general inflammation. It's going to turn up somewhere,
Mm-hmm.
but it's like limes. You go, maybe it'll
You don't
create
know.
lameness, maybe it'll create soreness, maybe it'll create sensitivity, maybe it just
I've
gives them a
had so
headache.
many, each horse in my barn acts differently. Like poor little Plumley, my halflinger, he blew complete quarter round abscesses on both front feet. His metabolic panel was perfectly fine until we had a meeting, and Callie, one of the osteopaths, says, "Have you checked him for Lyme?" And I said, "No, didn't think of it." And boom, it was Lyme.
Yeah.
So,
And the
don't.
laminitis, again,
It goes to the
laminitis.
weakest link. That was
Yes.
his weakest link for being a halflinger pony, is
Well,
laminitis.
and medically or scientifically, any condition that ends in itis
Yeah,
is inflammation. So if you think of
exactly.
that, I go
Yeah,
uveitis, cellulitis, right?
right. All of it is an
Arthritis.
inflammatory response. Yeah.
Exactly. And so anything that ends in itis is inflammation based. And
And I
so
think
that's,
sometimes we need to look more globally than just at that location.
yes.
Yeah, that we're kind of looking at the whole picture. And I think it's great that you and I bounce off of each other or with Stephanie or other people just, oh, well, that doesn't seem quite right. What else are we missing? What do we need to look at?
Yeah.
Yeah.
No, and testing for Lyme's, EPM, food allergies, or just putting a horse on a straight anti-inflammatory diet,
Yeah, forage-based diet.
forage-based diet, I go, it's never going to hurt the horse. The
Mm-mm.
worst side effect I've seen is the weight loss, severe weight loss, but I don't think it's severe weight loss. I think it's a
In
relief of inflammation.
our eyes don't like it.
Yeah, definitely.
Our
Yeah.
eyes don't like it, but are we getting down to a healthy, muscular horse to build upon that instead of putting layers of inflammation and fat on top of a healthy horse?
Yes. I
Yeah,
think it's the truth.
I
I
do.
think
I
I
I
think
completely
that
agree with you.
that rapid and severe weight loss when I changed her diet, because none of the other horses lost an ounce.
When you
None
changed
of
them,
none of the other
maybe
horses
they
lost weight.
weren't in such a depletion like she was.
Well, like I said, it was her unique inflammatory response
Right,
that caused her to look like she dropped 100 pounds in a week,
right.
right? Everybody else, it's like the warm blood didn't lose weight, but his cankles went back to
Went
normal,
away.
right? The other horse was more comfortable in his joints, but didn't lose a pound when I changed his diet. The
Right.
other two mares didn't lose weight at all, and their metabolics changed. So each horse in
Could
my
look at all the
barn,
different things.
each
Yeah.
horse just in my little barn had a different response.
Hmm.
And so it was like Prima's response. She was the only one that had the severe weight loss when I changed the diet. And I think what appeared to be a weight loss was her releasing the inflammation.
I agree. And I think I've heard that a lot when I've been working and listening to conversations with Stephanie and clients. I hear this a lot.
Hmm.
My horse has lost a lot of weight, and Stephanie has to reassure them it's a healthy weight loss
But I'll tell you what, it's not easy. That's
to see
why I
it.
wanted to
Hmm.
talk about it today on the podcast,
Right.
because I think I started videotaping Prima maybe back in late February or March is when I started that
Mm-hmm.
playlist on my YouTube channel. And she was one of the first horses I did a training update on. And I had already been long reining her and working her, and she had put on maybe a little bit of weight, but she still looked pretty skeletal when I started the video series. And even since then, so let's say March, April, May, June, we're in July, I go, we're 5 months into her, still looking too skinny, but looking better
But
month by month.
everything else is healthy.
All the other signs that she's
All the other
healthy
things
are
are healthy.
consistent,
Right.
right?
It's just our eyeballs that,
But I can see where people would lose patience and
oh
want to
yeah,
throw some commercial feed. And the only reason I've had the patience not to do that was her second colic episode.
right.
I
Or
go,
ulcers. A horse could present. We haven't talked about ulcers, but that's sure a big thing.
that can be it too. So every
Yeah.
horse just having an itis response to
Hmm.
something is inflammation. And I really wanted to encourage when people go on this forage-based diet, and the podcast with Stephanie are still back there somewhere around
Yay, 90
100.
something,
Yeah,
94 to
between
something.
90 and 120, somewhere in
I
there.
think so.
Um, but that if the horse has this massive weight loss, hang with it. Like, I just want to
Yeah,
encourage people to hang with it. Let your horse look terrible and just keep the horse gently working because there's a tightness to the muscles and an
good point.
atrophy.
Hmm.
I didn't realize how atrophied and tight my mare was across her entire
She
top
was an
line.
extreme case where my big mare was not that extreme, but
Yeah,
my mare is a lot younger
yeah,
too. So I think
yeah.
that makes a big difference. Older horses, boy, they can go down the toilet quick,
But for her to turn around the way she has between the age of like 29 to 31, I go, that's
so she's looking
actually
better.
what I want to show on the playlist is
Oh,
that it
that would be
is,
cool. Yeah.
it's also never too late.
It's never too
It's
late. I
also
agree
never too
because they're
late.
very adaptable.
Well, and anything that supports the body in authentic health is still going to make a difference at any age.
Yep.
And so
Even
I'm
for
really
people.
glad. I'm sort of blessed that she had the second colic that made me determined to stick to this new forage diet
Good.
because I think now coming out the other side of it, she's better in
Right.
many regards from that, even though she still looks a little thin, but oh well, it's coming.
It's
So I
coming.
guess with that, we better wrap it up. I think this is a long podcast, but
Okay.
super important, I think, for owners and trainers to
Owners.
recognize these inflammatory responses. And a good chunk of them might be related to just those diet
Right.
items.
I
And just if
agree.
we eliminate them from the diet and add a little fat supplement and some vitamins and minerals, that hay-based, forage-based diet, I think so many things can change. And then we do the face palm going, why didn't I do this before?
Hey, yeah, we're all on a learning curve.
Exactly. So thank you everybody for joining us. We better wrap this up pretty quickly because it's a long one. And if you stayed all the way, thank you very much. And thanks for that comment on the YouTube channel because that's what kind of sparked. I had this in the back of my mind to talk about as a podcast, but now it's done. Now we did it.
Yes, comments welcome.
Yes. And still recommending, I will put Stephanie's contact information
Yep,
in the
that'd
notes
be great.
because she has been such a help at
She is. She's
finding the
really
right
smart.
supplements, doing her
Hmm.
research, and supporting that transition for horse. And she'll does do it. She'll do it by phone consultation, so
Yes, you don't have to be present.
you don't have to be local for her to help out.
Exactly.
Yeah. All right. Thanks, everybody, and we'll see you next time.
Bye.
Bye.